We all are welcome to our beautiful State House. We have good news. We're making great progress. When the COVID-19 virus hit, South Carolina chose a wise approach. It was carefully targeted and factually based, and it worked. It was a deliberate, careful approach. This is the same approach that we have been and are using on vaccinations. Our priority was and is to save lives. That was our focus. Our moral and ethical duty was to first protect those at greatest risk of dying from the virus and protect those who keep them and the rest of us alive. That group included hospital and healthcare workers, first responders, residents and staff of nursing homes and long-term care facilities, and our seniors aged 65 and up. In the month of February, South Carolina made tremendous progress on expanding access to the vaccinations. As the supply of vaccine increased, new shot locations opened every day. Our hospitals, pharmacies, and healthcare providers became more efficient at getting large numbers of our seniors registered and vaccinated. By staying the course and resisting the loud distractions and potential disruptions, over 1 million South Carolinians have now received the vaccine. Because of these successes, we are now in a position to make the majority of South Carolinians eligible to receive the vaccine. We are ready to enter what is referred to as Phase B, which is the next phase. Starting next Monday, March the 8th, individuals in the following groups will be eligible to make appointments to get vaccinations. And if there's a space available, they can get that vaccination that same day. Individuals age 55 and above. Individuals age 16 to 64 with high-risk medical conditions, including but not limited to the following: cancer, chronic kidney disease, chronic lung disease, diabetes, Down syndrome, heart disease, hypertension, HIV/AIDS, organ transplant, obesity, pregnancy, and sickle cell disease, among others. That's for 16 years old and above. Also included are special needs persons who have developmental, physical, or other severe high-risk disabilities that makes developing severe life-threatening illness or death from COVID infection more likely. Also included will be frontline workers who perform a job in which they are at increased risk of exposure due to their frequent, close, and face-to-face contact with others in their work environment. A few examples of these workers are these: K-12 and higher education, health care, child care, law enforcement, criminal justice, manufacturing, hospitality, transportation, service, agribusiness, retail, local, state, and federal government employees, and group homes, among others, as will be described by Dr. Summer. Also, I am asking any state resident that has made multiple appointments trying to get vaccinated, if you have already received your vaccination, please go back and cancel out the future unneeded vaccination appointment, so those appointments and that time and that vaccine can be freed up immediately for others who have not yet received their vaccination. Finally, on schools. A few weeks ago, I directed school districts to finalize their vaccination plans with their local health care providers and to submit them to Superintendent Spearman and the Department of Education for review. Superintendent Spearman and a team have worked to verify each school district's vaccination plan so that our teachers can be vaccinated as quickly and efficiently as possible, as mentioned above in 1B. Many local health care providers and school districts have planned to conduct teacher-specific vaccination clinics. Held on school grounds on weekends, afternoons, or at specific times, these coordinated clinics will allow teachers to be vaccinated quicker than if the teachers had to make their own individual appointments. Superintendent Spearman will describe that further in a moment. Finally, we know that students have lost significant learning progress due simply to being out of the classroom. It is clear not only in South Carolina, but all over the country. Parents should not have to choose between their jobs and their children. Parents must have the option of sending their children to school 5 days a week, face-to-face instruction. That is why they pay taxes. Our schools must, I repeat, our schools, all of our schools must open 5 days a week. I've repeatedly asked the General Assembly to send me a bill requiring schools to offer all parents the option of in-person 5-day-a-week instruction for their children. They must have that option. Today, I repeat that request to the General Assembly. There are no more excuses or justifications for every one of our schools not to be open 5 days a week for face-to-face instruction. The consequences of not doing that are immeasurable. Our schools must be open. Now I'll ask Dr. Summer of DHEC for his remarks.